Another top story tonight, prosecutors say healthcare workers who divert drugs and put patients at risk are avoiding criminal charges thanks to a system that often protects them from prosecution and allows them to find new jobs.
It's our community watchdog's latest discovery. Prosecutors now are demanding a notification every time a doctor, a nurse, or another medical professional is suspected of taking drugs on the job.
You know, employers are not required to do that under current state law, but that could change when lawmakers head back to Nashville. Think about this for a minute. If you or I witness child abuse in Tennessee, we are legally required to call police, but not if we see a hospital employee take a patient's medication. At least 2 to 3 times a day. That's how often a former Johnson City Medical Center nurse diverted pain meds, according to state records. Meanwhile, another former JCMC and Franklin Woods nurse diverted patients' pills for more than a year, according to investigators. A grand jury indicted both women earlier this month after the Department of Health contacted the Tennessee Bureau of Investigation. But for every one of these cases, prosecutors in both Washington,
I would like to also see notification,
and Sullivan counties told us there are plenty of others where law enforcement's either completely left out of the loop or alerted too late.
If there was an immediate reporting to law enforcement, we could begin to have an effective, I think, investigation to determine whether or not they've broken the law.
We first identified concerns about a lack of reporting by some area hospitals in December. In the month since, Sullivan County District Attorney Barry Staubas sent the state's health commissioner a letter calling for mandatory reporting, similar to Tennessee's child abuse law.
We think if it's important enough for children to be reported, why wouldn't it be important enough for medical professionals?
If I witness child abuse, I have to report it to law enforcement. It's against the law if I don't. Why not make the same requirement for a doctor or a nurse who's taking drugs away from a patient and putting them in harm?
That's a very good question, and that's one of the things we'll address and see if we can kind of close the loop on that.
Prompted by our investigation into disciplinary delays, Representative John Holtzclaw helped pass a law last session meant to better protect the public from drug-addicted healthcare workers. But the State House Health Committee member acknowledges there's still more to consider.
We'll continue to take those steps to try to see if we can strengthen that law.
We want to deter diversions of drugs by professionals.
Lawmakers did pass another law last session that improves reporting, but only at the licensing level. It requires the CEO of a hospital or other healthcare facility to report all disciplinary action involving drugs or alcohol to the appropriate state licensing board, something the health commissioner in a letter to Staubas called a significant step. But that law stopped short of requiring a referral to law enforcement. It's important to note not everyone's on board. Remember, our reporting prompted a law that requires workers who fail drug tests to enter treatment or get their licenses suspended. The Tennessee Nurses Association told us today it wants to give that more stringent policy a chance to take effect, adding, quote, "We would not support a process that circumvents the new law based on a suspicion," end quote. The Tennessee Medical Association, on the other hand, told us in general terms it, quote, "supports increased transparency, reporting, and appropriate prosecution for healthcare providers who engage in illicit activities."
Nate, thank you. As we reported last week, the chairman of the Senate Health and Welfare Committee asked state attorneys to study another possible change in state law related to those healthcare workers who do face criminal charges and are able to get their crimes expunged.